Before we start TMS, we do a thorough evaluation of each patient who is referred to us. So you will meet with one of the partners in our practice who will sit down with you for roughly an hour, get a complete history, make sure that the diagnosis is correct, make sure that there are no reasons to not have TMS, which we can get into later. Once that is done, we set up a first session. You come to our office, and the technician and one of the doctors will take measurements of your head, because people's heads are shaped differently. So we'll measure around this way, and that way. We take those numbers and put them into a computer program, and that tells us where the spot is that we will be treating. We put a little dot over there, either with a Sharpie if it's going to be invisible because of your hair, or, such as in my case, it'll be quite visible, and we would use a ultraviolet pen similar to the stamp that you might get if you go into a club and they shine the black light on it. After we take those measurements, the next thing that we need to do is to find the lowest amount of power that we can use to get through the skin and the bone and affect the brain underneath it. The problem there is that we can't just put it over the place that we're treating, give it one click, and say, oh, so do you feel better now, sir? We need to have something objective that we can observe. So what we actually do is put it over a slightly different spot, a couple of inches further back, that controls the movement of the fingers. And so the doctor will hold the device over the person's forehead and look around for the spot that moves the fingers. And once we do that, we raise or lower the energy level of the TMS device until we only get the fingers to move about half the time. And that becomes what we call the motor threshold. We then take that number, add another 20% just for safekeeping, and now we're ready to go. Before we turn it on, we usually do it on the back of someone's hand just so that they can see what it feels like. And the nice thing there is it doesn't really feel like much. It feels like a tapping feeling. When we do it over the forehead, it just feels like somebody's going like this. The magnetic field is delivered in a series of pulses. So what we do is we give people 4 seconds of 10 pulses per second. So there's a rapid fire clicking sound that goes on for 4 seconds. Then there's a rest period, and then another 4 seconds of 40 pulses, etc., until we reach 3,000 pulses. 3,000 pulses can usually be achieved in about a half an hour, give or take. It depends on how much power we're using. The more power we need to use, the more rest period we need to use. During this, there is no confusion. People can talk, they can bring a friend in and have a conversation with them. Most people watch television while we're doing it. The experience is, again, like a tapping feeling, and often a little bit of twitching of the eyebrow, which is really not an unpleasant thing. It is relatively loud. We usually have people put earplugs in. When the treatment is over, people get up and they just go right back to their life. They walk out the door, they're perfectly capable of driving and going back to their usual activities. People come in 5 days a week for 6 weeks, and then there's a week of 3 treatments, a week of 2 treatments, and a week of 1 treatment. So it's a total of 36 treatments.